My name is Rebecca Barnes-Sloane, and I'm from Lexington, Kentucky, by way of Pikeville, Kentucky, which is a rural coal mining town in eastern Kentucky. My mother was a public school teacher, and my father was a banker. I had one sister, and the way that I ended up in Lexington was because of my sister. In 2000, my sister was complaining of being tired. She had a rash, itchy skin that would go away, so Mom took her to the doctor. She was a senior in high school. They gave her some cream and said, "Oh, you're tired, because you're like a teenager, and teenagers are tired," and sent her away with some cream. And she continued to be fatigued and tired for the next year. Fast forward until Thanksgiving 2001. She was a freshman at Morehead State University in Morehead, Kentucky. She had come home for the holidays. We were all at my mom's house, and my mom accidentally walked in the bathroom and found this huge knot on her collarbone. And because cancer runs in my family so strong, in fact, everyone on my mother's side of the family has passed away from cancer, my mom's first reaction was, "Oh my God, it's cancer," which of course scared my sister to death. So my mom made an appointment for her to go to the doctor the following week. Before the week had even ended, my husband passed her on the Mountain Parkway. She was on her way home. She was very, very ill. That Monday was December the 3rd, 2001. I remember that day very well. It was my son's birthday, actually. And my sister called and said, "Do you mind to be with me when I go to the hospital?" So I got in the car and I drove. I drove 2.5 hours home to be with her. They took her back. They did an x-ray and a CAT scan and MRI. And we kind of laughed because we were like, "We're sure this is nothing. It's probably cat scratch fever." We were thinking of anything that it would be besides cancer. We went down to the cafeteria to get some food. It was me, my mom, and my sister. And we were laughing and everything, and we got the phone call, and it was the doctor. It had not been 30 minutes that we had left the x-ray room, and they called to say it was Hodgkin's lymphoma. That was a day I'll never forget. My sister looked at me, and she said, "Sis, am I going to die?" And I just held it together because I didn't want her to see me cry, because I was so worried that my only sister was going to pass away. And we were 8 years apart, so I had waited like 8 years to have this little baby sister in my life, and God wasn't going to take her away from me. So over the next 4 years, I moved to Lexington because it was obvious that Pikeville did not have the treatments available for her that would have her best care. So she went to the University of Kentucky Markey Cancer Center. And over the next 4 years, she would undergo chemotherapy, radiation, lung biopsies, and 2 stem cell transplants. My mother would take early retirement, which would mean that she had to pay to take that early retirement. And when she was retired and got Social Security, she would get less money than she would have if she would have been able to stay working longer. My father was a banker, and he had to take weeks off of work so that he could drive and stay in Lexington, because it was a 2.5-hour drive. And of course, after you have chemotherapy and radiation, you're really tired and you're really sick, and driving on a curvy road, it's just not the best thing. But we were lucky because we had a lot of support system, family members, and people in the workplace that gave of her sick days and, would offer money. And there was a fund, so they were able to stay in hotels, which, you would think that would be something you'd be grateful for, but you get really tired of staying in hotels and hospitals. So those 4 years passed. She had a stem cell transplant with her own stem cells. And I actually was a full 6 out of a 6 match for a stem cell transplant for her. So I went in and did that. And unfortunately, the cancer came back more aggressive every single time. And so the doctor called her in one day and said, "We're not going to be able to cure this. But we can treat this. We can do the best we can." And so she undergone radiation again. And she looked at me and she said, "I'm tired. I'm ready to go home." So they put her on hospice care, which was, we were very grateful for that. She had palliative care. Not all the palliative care that she could have had, because no one told us that those resources were available to her. There were a lot of people from Eastern Kentucky that came there that slept in their cars. They could not afford a hotel room. There were a lot of people that didn't have a lot of food, so they would kind of eat what was given to them in the hospital. A lot of them didn't have gas, so some of them would be come alone, and their family members would go back home, so they would have their treatment alone. So it wasn't just my sister, and my sister was probably one of the best cases there as far as having support. A lot of people in rural areas do not have that support. So the last day that we were in Lexington together as a family, she was at the hotel room, and she couldn't walk at that time. She was 22 years old, and we're sitting there, and my parents are gone, and I look at her, and I just have this overwhelming feeling of guilt because, you know, the doctor had said, your sister isn't going to probably match. You know, there's a 1 in 4 case. There's no way. And I thought, wow, this must be God's way of saying, you know, I'm going to save her life. And so I had this guilt, and I looked at her, and I said, I'm sorry. I'm sorry that I cannot save your life. And she just started crying, and she said, you gave me 9 months that I would not have had. And we never really talked about it after that we knew that she was going to pass away. She went to her home in Pikeville, and I would come every weekend or every other weekend that I get to go. And I would stay with her, and I would lay in bed with her for hours, and I just wouldn't know what to say. I was just quiet. And I looked at her, and I said, I'm sorry that I just don't have the words. And she said, you know, it's good that somebody can just sit here and be with me and just hold this space with me, because some people get nervous and they come in and they talk and they ask you how you feel and how you're doing. Well, you know you're dying, you know. And so sometimes it's just good to have that with people, that you can have that space for them. And so that, you know, it made me feel good to know that I was just there with her. I said, well, I'll see you next Friday. I'll be coming. I used to, you know, give her a little massage on the back, do a little pedicure for her, you know. And she said, I'll see you next Friday. Next Thursday came, and I woke up like at 5 in the morning, and I was just like this nervous wreck, like I just knew something bad was going to happen. And I called my mom, and I said, tell Rachel I love her. And she said, how did you know? And I said, how did I know what? She said, the hospice nurse is here. She's not going to be here much longer. So that was July the 28th, 2005. My sister passed away that morning. She went through a lot, as do most people that come to the terminal illness of having cancer. But the reason that I'm a patient advocate today, because I have my own story, but I'm here to tell her story because she's not here, to tell, you know, to have her voice, like the many people that are with her at that time that have passed away, and the many people that are going through treatment right now. And that there are palliative care out there for people. They need to know it. Our nurses and doctors need to be able to they need to be sharing those resources. So we need to be patient advocates to let the doctors know it's okay. After my sister passed away and I went back to the hospital, and I was like, why don't we have these options for our patients and their families? And what they told me is, we do have some of those resources, but it's taken advantage of, so we don't tell them unless they ask. So I didn't have a lot of money at the time. I have 4 of my own kids, so I would just basically make crock pots of food after my sister passed away and take up and leave at the family kitchen. So just know that sometimes when other people don't do things, that we have the ability to do it ourselves, you know, and we have the ability to inform other people of those resources. And that's why I became a patient advocate, and that's why I'm grateful for NPAF, because for me, as therapy for me, it was being able to be a voice for those who do not have a voice. And thanks for listening.